If you are on Medicare or if you are about to go on a Medicare plan, this video is for you because something is about to change. For years, literally years, one of the most common questions Medicare patients have been asking their doctors is, Doctor, I want to try Wegovy or Zepbound for weight loss. Will Medicare cover it? And for years, they were given the same answer, no. Medicare doesn't cover weight loss medications, never has. It is actually written into the law. But starting July 1st, 2026, that answer will officially change. There is a brand new program. It is called the Medicare GLP-1 Bridge, and it could get Medicare patients access to Wegovy or Zepbound for just $50 a month. $50 for the same medication that has a retail cost of over $1,000 a month without coverage. Now, there are things that you need to know because not everyone qualifies, not every weight loss medication is included in the program, and there are some important catches that you may want to know. So stick with me. By the end of this video, you're going to know what exactly this program is, whether you qualify, what it costs you, and the exact question you need to ask your doctor. Hello and welcome back. If you're new here, I am Dr. Baza Khalid and I'm a board certified internal medicine and obesity medicine doctor. Today, let me break down the new Medicare GLP-1 Bridge program. This is real. This is starting very soon and it could truly be life-changing for millions of people who have been shut out of weight loss medication because of lack of coverage and high costs. So let's start at the beginning. Because to understand why this program is such a big deal, you need to understand why Medicare did not cover GLP-1 medications for weight loss before. This is something a lot of people don't know. There is actually a law that says Medicare is not allowed to cover medications prescribed purely for weight loss. It's been that way since Medicare Part D was created back in 2003. So even though GLP-1 medications like Wegovy and Zepbound have been FDA approved for obesity, Medicare did not cover them due to weight loss coverage exclusion. Now, these same medications, if they were prescribed for type 2 diabetes like Ozempic or Mounjaro, then Medicare could cover those medications most of the time, but not the weight loss version of these GLP-1 medications. So the Medicare non-coverage of GLP-1 medications for weight loss created this crazy situation where millions of Medicare patients, many of them in their 60s and 70s, carrying extra weight, that was damaging their joints, their hearts, their kidneys, were told, sorry, the law says we can't help you with your weight. And these GLP-1 medications have a retail cost of over $1,000 a month without coverage. There are some direct discount programs bringing the cost down. However, most people still have to pay $200 to $400 per month for these medications, depending upon the dose and the medication. So most people on Medicare just couldn't get the GLP-1 medications. And that's why this new program is such a big deal. Okay, so what exactly is the Medicare GLP-1 Bridge program? The Center for Medicare and Medicaid Services, that's the government agency that runs the Medicare program, announced this program in December of 2025. And they called it the Medicare GLP-1 Bridge. This is a short-term pilot program, a short-term test. The government is trying it out to see how it works before they commit to something more permanent. This program starts July 1st, 2026, and right now it's set to run through December 31st, 2027. So for about 18 months. And here's the really important design feature of this program. Medicare GLP-1 Bridge program operates completely outside your regular Medicare Part D plan, which means your specific plan doesn't have to do anything special. It doesn't need to update its formulary. You don't need to opt in. This program will be handled directly by the federal government through a central processor, Humana. Which means, in theory, if you qualify, you can access these medications at your pharmacy without your Part D plan being the gatekeeper. That's really a different setup from how these medications have been handled before. Let me ask you something. Are you on Medicare right now, or do you have a family member on Medicare who's been wanting to get on one of these GLP-1 medications but couldn't due to the lack of coverage? Let me know in the comments. Okay, so let's talk about who actually qualifies for the Medicare GLP-1 Bridge program. Requirement number one is you must have a Medicare Part D coverage. This program is only for people who are enrolled in a Medicare Part D prescription drug plan. That could be a standalone Part D plan or a Medicare Advantage plan that includes Part D drug coverage. Requirement number two, the medication must be prescribed for weight management. This matters. If you're already taking Ozempic covered through your Medicare Part D plan because you have type 2 diabetes, that is a separate thing and not covered under this plan. The Bridge program is specifically for people needing GLP-1 medications for weight loss. Requirement number three, your BMI and health conditions at the time you started therapy should qualify for coverage. Your eligibility is based on your BMI and comorbid conditions when you first started your GLP-1 therapy. If you're already on GLP-1 medication, not necessarily your BMI now. So if you started Wegovy 2 years ago, lost 30 pounds, and your BMI has dropped now, don't panic. Your doctor can attest that you met the criteria when GLP-1 medication therapy was started 2 years back. That's a really important detail. And if you have never been on a GLP-1 medication in the past, then your doctor can check and see if you meet criteria based on your BMI and health conditions. Now, under the third requirement, there are three eligibility pathways. Think of them as three doors. You only need to qualify through one. Number one, BMI of 35 or higher. If your BMI is 35 or above, or was 35 or above when you started GLP-1 medications, if you're already on one at this time, then you qualify. No other condition is required. Number two, BMI of 30 or higher plus certain serious conditions. If your BMI is 30 or above and you have been diagnosed with heart failure, uncontrolled high blood pressure, or chronic kidney disease, you may qualify through this pathway. Number three, BMI of 27 or higher plus pre-diabetes or cardiovascular history. This is the broadest door. Your BMI of 27, which is technically just overweight, not even obese, can qualify you if you have pre-diabetes or a history of cardiovascular issue like a heart attack or stroke or symptomatic peripheral arterial disease. Now, the best estimate right now appears to be that around 14 million Medicare beneficiaries, which is roughly 20% of the entire Medicare population, may qualify under this program, not just those with the highest BMI. The program recognizes that weight-related health conditions matter as much as the number on the scale. And one more thing, if you meet these criteria, you do not need to have tried and failed other weight loss medications first. There's no step therapy requirement here. That's a big deal because a lot of insurance plans normally make you jump through those hoops. Okay, so now you know who qualifies. Now let's talk about which medications are actually covered in this program. Right now, as of July 1st, 2026, three medications are covered under the Bridge program, and they are specifically the ones approved by the FDA for weight management. Number one, Wegovy, injection form as well as the tablet form. Number two, Zepbound, the quick pen injection version. Number three, Foundayo, the oral pill. Foundayo is a newer oral GLP-1 medication. It's a pill, which is great news for people who aren't keen on injections. I have a video on all three of these GLP-1 medications that you should be able to find under the playlist called the GLP-1 Weight Loss Guide. Let's talk about what this actually costs you. Under the Bridge program, you pay a fixed $50 copay per month. That's it, $50 every month, regardless of your dose, whether you are on the starting dose of these medications or the highest maintenance dose of GLP-1 medications, $50. Okay, so you think you may qualify. What do you actually do? Step one, talk to your doctor. This starts with your doctor, who will need to determine whether you meet the clinical criteria, and then your doctor sends a prescription for one of the above medications under the diagnosis code of obesity on your behalf. Step number two, your pharmacy and doctor's office work together to request the prior authorization from the central processor, which is Humana, set up by Medicare. Not to your Part D plan. This is different from how normal prescriptions work. The central processor will handle all approvals, claims, and payments. You cannot go around this step. The prior authorization is required. Step number 3, once approved by the central processor, your pharmacist will use a specific billing code to process it through the Bridge program rather than your regular drug plan. You pay your $50 and get your prescription from your pharmacy. Now, you don't need to register for the program in advance. There is no sign up, no opt-in form. If you qualify and your doctor submits the prescription and prior authorization, that's the whole process. And remember, this is available nationwide in the USA, all 50 states. So wherever you are in the country, if you have Part D coverage and you meet the criteria, this program will be accessible to you starting July 1st. Now, I want to spend just a minute on what this program is not, because understanding the limitations is just as important as understanding the benefits. This program is not permanent yet. This program runs from July 1st, 2026 through December 31st, 2027. After that, the balance model was supposed to take over. But balance is voluntary for insurance plans and not enough Part D plans have agreed to participate. So this is not finalized yet. And also the Bridge program is not for Ozempic or Mounjaro for diabetes. If you use those medications for diabetes management or Zepbound for sleep apnea, they will continue to go through your regular Part D plan as before. The Bridge plan only covers the weight loss management approved versions of these medications. I always believe that a prepared patient gets better care. So here are the questions I want you to take into your next doctor's appointment if you have Medicare Part D coverage and wondering if this program may help you. Ask your doctor. Number 1, do I qualify for Medicare GLP-1 Bridge program based on my BMI and medical history? If the answer to that question is yes, then number 2, which of the 3 covered medications, Wegovy, Zepbound, or Foundayo, would be the best fit for me? And number 3, can you submit the prior authorization to the Bridge program central processor? Let me ask you, do you know someone who's been turned down for GLP-1 medications for weight loss or who's been paying full price because Medicare wouldn't cover them? Share this video with them. Seriously, it could save them hundreds of dollars a month. And the people who need this information most are often the ones who don't know it exists. For years, we have known that GLP-1 medications can genuinely transform health outcomes. Obesity isn't a willpower problem, it's a medical condition. And the medications we have now, like Wegovy, Zepbound, and others, they work. The science is clear, but access and affordability have been the walls keeping people out. This program, new and imperfect as it may be, temporary as it is the first time Medicare has ever provided a direct pathway to coverage for weight loss medications. This is historic. This is great. If this video helped you, please hit that like button. It takes 1 second and it helps this information reach the people who need it most. Subscribe if you haven't already done so. I post a new video every single week on weight loss, metabolic health, and the real science behind these medications. Stay happy, healthy, and well. Bye for now.